Paster standing by at his office in Oregon, taking your calls at 270-9933. If you're on the line, stay there. We'll get to your calls in just a sec. Hi, Zorba. How are you?
Good. Very good, thanks.
We're looking at long working hours linked to heightened depression risk in women. What's the study about?
Right. Right. This is a study that was just published in the British Medical Journal, and it's part of a longitudinal study that's taking place in the United Kingdom. They looked at men, they looked at women, about 40,000 men and women in total, and they looked at the men and women who worked 55 hours or longer for the week. So they might have a 40-hour job, and they might have a part-time job with it, or they might have 2 or 3 part-time jobs. And then they looked at mental health, and lo and behold, they found that women, more than men, women who worked 55 hours a week or more were at a much higher risk for depression. Part of the reason they think maybe that a lot of women have to go home and then they have chores to do at home, but they're not exactly sure why. But there really is a take-home message. The women who worked weekends were much more likely to be depressed. The women who worked work hours where they worked at night were more likely to be depressed. And what was very important is that women who sought help because they had depression actually improved because they saw their doctor, their health care provider, and actually got help. So the bottom line here is if you're working 50 or 55 hours a week and you're depressed, you are not alone. And the answer may be to either seek help from your healthcare provider or to seek help at home so that you can get rid of some of those chores that actually are part of the depression syndrome that's occurring. Very, very interesting data. Very important for any woman who works long hours.
Yeah, try to change the situation if possible.
Yep.
Make it better.
All right, we got some calls waiting, so let's get to the phones. We'll start with Diane in Madison. Hi, Diane.
Hi, how are you?
Great. What's your question?
Good. Okay. How you doing, Dr. Zorba?
Very good, thanks.
My question is, after a person has knee surgery, how long should that person stay on pain medications? And this is part 2. And if they are on that medication, what is the time frame that they should stay on that? Because we know that some opiates are kind of pain medications can lead to an addiction. So how long would you suggest that they should stay on that medicine?
You bring up a good point. The short answer is as little as possible. And quite often orthopedic surgeons will give a huge amount. They'll give maybe 60 tablets or 100 tablets and say take them until you feel better. And we now know that when that occurs, you're at a higher risk for addiction. So anti-inflammatories, which often orthopedic surgeons say you have to stay away from, are not used. Arthritis strength Tylenol, it's an 8-hour pill, 2 tablets every 8 hours will help a lot of people. And then you want to taper off those opioids as soon as you can. And that's critical. And I'll give a perfect example that happened in my office today. Young man came in, he never had any drug problem, went to the dentist, had wisdom teeth removed, had hydrocodone, had only 4 tablets, and said, gee, this feels good. And he ultimately became addicted from that. He has fought that addiction successfully, but it was just that little bit of opioid that made a difference. So the answer is less is best.
Yeah, it doesn't take much.
Does not take much, no.
Let's go to Mary from Madison. Hi, Mary. What's your question?
Yeah, I was wondering what to do about low back pain.
Well, first of all, best thing for low back pain is to get out of bed and start to move. We used to put people in bed for 1 week, then we found out that was wrong. Then we put people in bed for 3 days, we found out that was wrong. The best thing to do for back pain is as soon as you can, get up and start moving. Back exercises are excellent. Go to the web, Google back exercises, Google them from the Mayo Clinic or Google them from a reliable source, and there are great exercises that you can do. And then anti-inflammatories, 2 Aleve tablets twice a day for a week can often help people with low back pain. And then, of course, there's massage, there's chiropractic, and there's yoga.
And physical therapy, too, as well?
And physical therapy, of course.
All right, we were talking at the top of the show how crabby people are because of this weather. Any advice besides going to Florida for a week?
I think you should have prayers for warmer weather. That's probably about the advice that I can get. But it's very difficult when it's cold like this. I think getting out and doing something is really important. We get cabin fever because we don't want to go outside. And that, of course, is a problem. That's about my advice. I don't recommend that you go on any pills. You just have to get outside as soon as it's warm.
It will warm up eventually. Zorba, thank you. Thank you, everyone, for calling in. We'll
pleasure, guys.
See you soon. We'll have a final check here for you.